Now, the hazard ratio is significant with actually a significant p-value. The only curious thing that we have to be notable to is the fact that the median is actually 11 months and 10.9 months. So in other words, is that the separation of the two curves occur almost after 8 or 9 months of being on the drug. So we do not actually understand the mechanism entirely why we have this kind of shape of survival curve. However, a positive study is a positive study, so it demonstrates a improvement. But then whether the improvement is substantial for us to change the practice completely, that will be debatable. So now if I have to look into the potential explanation, then we may have to consider whether there is some degree of T-synality-M inhibition with the second generation that occur on the later time, so such that we may delay the occurrence of T-synality-M. However, without rebiopsy at the time progression, we cannot prove this hypothesis one way or the other. So that's one potential explanation in this regard. But certainly at this moment, I would not have any so-called definitive explanation why we observe this phenomenon, that no separation for the 9 months and then separated subsequently. I think, as I mentioned earlier, this is the first randomized study that had head-to-head comparison that give us some idea between, as a group, second-generation TKI and first-generation TKI. And so it does give us a signal that there may be higher, hazard ratio that is positive for progression-free survival. And I think that will give us some idea to ask the question, why? I think asking the question why will help us to move ahead of how to give the best and optimal treatment for our patient. At this moment, as I said by Pasian, it remains a choice.